Hi, my name is Sarah Hanson. I am a student occupational therapist. I will be working with you today. So after reviewing your chart, I saw that you currently have a neurocognitive disorder due to Huntington's disease, which is a progressive disease which alters your mood and movement and cognitive skills due to affecting the central area of your brain. So I think it'd be beneficial to implement a medication management plan, and this will just help you be more independent and successful in one of your ideals. And in your chart, I saw that you're taking Exnazyme, which is a prescription to help subdue some of those involuntary movements or delay in voluntary movements. And so one of the precautions for that medication is do not operate a motor vehicle or any hazardous machinery. Do not drink alcohol. And to take that prescription exactly as prescribed. Um, Please consult your physician if you skip a dosage or discontinue it, and they can redirect you in taking the correct dose. Another prescription that I saw in your chart was Seroquel, and this is a prescription to help treat some of the irritability or aggressiveness that you might feel throughout the day. Some precautions for this medication are the same. Do not operate a vehicle, do not drink alcohol. It's important to rise slowly when you're laying down, and to help avoid some of the lightheadedness that you might feel. And it's important to check your vitals. So check your blood pressure, monitor your blood glucose, and to kind of keep an eye on your low blood count, which can also put you at risk for infections. It's also important to note the side effects to these prescriptions. So Exnazyme, the side effects could include tiredness, queasiness, anxiety, difficulty sleeping, depression, suicidal thoughts, or suicidal actions. For Seroquel, the side effects could include dizziness, weight gain, tiredness, dry mouth, and lightheadedness. In addition, I think it's important that you educate your caregiver to help recognize some of these side effects. That way, they can help you get some help from your physician or pharmacist to help alter your medications or treat some of these side effects. So for your medication intervention plan, so after reviewing some information, I saw that you are a homemaker and you currently live with your husband. And some of the activities that you like to do are painting, gardening. So I encourage you to keep participating in those activities. So for your medication, I think it would be great to get one of these pill organizers. It has a slot for each day of the week. Some of them also have a slot for the AM and PM to just help divide your medications. So I would like you to designate a day that you sit down and fill out this pill box to help prepare you for the week. And to do that, you'll follow your medication and put a pill for each slot that you're supposed to take it at. And I would like you to leave this in a visual place where you can see it. So this might be on the bathroom counter, in your kitchen, on your nightstand. That way it's out and it's a reminder to take your medication every day. In addition, if you need another reminder, you can place signs in the house, such as on your bathroom mirror. You can put a sticky note to just help tell you to take your medication. In addition, I think it's important to keep all your medication in the same spot. So I have this little box and I just put all my medication in here. And I have a book to help organize all my phone numbers and keeping an active list of all my new prescriptions and any alterations in dosages. It's also important to keep a list handy in your purse or in your wallet. So on an index card, you can just write that all down. That way you have it handy. So to help remember to take it at the same time, I think it would be great to set an alarm on your phone so it can go off. That way you're not taking a double dose or forgetting. That way time is very important. And then if you aren't able to set it on your phone, you can buy an additional clock and set it an alarm on that. If that plan is not working for you, there are some adaptations we can make, such as involving your caregiver, which is your husband. In this plan, he can also set an alarm on his phone as a reminder to help cue you to take your medication. In addition, he can help with filling out the pill box in the beginning of each week, just to make sure you're selecting the right pills to put in the correct days. So he can be a great source to help assist you in this plan. I think it's also important to educate him on some of the side effects that you might be having. That way he can just help guide you in the right direction. So it's also important to remember to always have an emergency plan or a backup in case of a natural disaster or you leave town and you forget your medication. So you can always refer to that list that you keep in your purse with that updated list of all your medications and the dosages. It's also important to have all the phone numbers on you. That way you can contact your pharmacy and they can have all your prescriptions filled for you. In the event that you have time to prepare for your emergency, you can grab your box with all your prescription bottles and your list with all your phone numbers in it. That way you have all your supplies ready for you and it's in a safe spot and it's just quick to grab in an emergency. So if you have any questions about the dosages that you're taking of your medication or any side effects that you might be experiencing, please remember to contact your pharmacy or physician to help you with that. If you have any questions on your intervention plan about how to remember to take your prescription or if it's not working for you, please feel free to contact me and I will get back to you as soon as I can. So thank you for your time and I wish you the best of luck with your new intervention plan.